Cisplatin by Regina Sanchez. Cisplatin is an anti-cancer chemotherapy and platinum-containing drug. It is a treatment for testicular cancer, ovarian cancer, bladder cancer, esophageal cancer, non- and small cell lung cancer, breast cancer, cervical cancer, stomach, and prostate cancer. It is also known to be used to treat Hodgkin's disease and non-Hodgkin's lymphoma, neuroblastoma, sarcomas, multiple myeloma, melanoma, and mesothelioma. Cisplatin is administered through a vein as an infusion. It's either done intravenously or through an IV. There is no pill form to be taken. The mechanism that cisplatin uses is that the alkyl groups attach to DNA bases, which results in DNA being fragmented by repair enzymes in an attempt to replace the alkylated bases. This prevents DNA synthesis and RNA transcription of the affected DNA. Another form is the formation of the crosslinks causing DNA damage that prevents DNA from being separated for synthesis or transcription. Induction of mispairing of nucleotides leading to mutations. They stop tumor growth by cross-linking guanine bases in DNA double helix strands directly attacking DNA. This makes the strands unable to uncoil and separate, as this is necessary in DNA replication. The cells can no longer divide. In addition, cisplatin adds methyl or alkyl groups onto molecules where they do not belong, which in turn inhibits their correct utilization by base pairing and causes a miscoding of DNA. The pathway that cisplatin uses in cancer cells is that it has the ability to cross-link with purine bases on DNA. This interferes with the DNA repair mechanism, causing DNA damage, which ultimately leads to the cell not being able to repair the DNA and causing apoptosis, which means cell death in cancer cells. In normal cells, the repair of intrastrand DNA crosslinks can be initiated by encounters with transcriptional apparatuses or a replication fork. The repair pathway depends on the mode of recognition. In the context of a non-replicating DNA, the first incision step on either side of the lesion on one strand of the duplex by XPF-ERCC1 complex, and the NER pathway will initiate the second cycle of repair and remove the remaining adduct on the opposite strand. When the repair is initiated by the replication fork, it depends on whether it is a stalled replication fork, a single or dual fork encounter, or if it's a double or two fork stalled by the ICL polymerases. Side effects of cisplatin include gastrointestinal, which are nausea and vomiting, which are the most common, and then occasionally diarrhea can happen. Then there's nephrotoxicity, which is kidney damage because cisplatin accumulates to a greater degree in the kidneys because that's its major route of its excretion out of the body. Then there's hematologic symptoms, which include decreased red blood cell counts and hemoglobin lowered counts, and it can cause symptoms of anemia such as fatigue, weakness, and shortness of breath. There's also decreases in white blood cells or the immune system proteins that can cause and lead to increased risk of getting an infection. Then there's changes in hearing, which is also known as ototoxic effects, and this can be caused because of the related peak of plasma concentrations of cisplatin because of the injection. There are some uncommon side effects, which include temporary hair loss, signs of dehydration, and changes in vision. My question is, how is it that cancer cells are able to build up the resistance to cisplatin? I read several different articles that said that they are able to, and I just wanted to know why and how. And these are my references.